Welcome everyone up here to this next panel that I've been really looking forward to. We are discussing comorbidities that we might experience in the presence of rare disease. So let's begin just with a brief introduction to each of you, your name, where you're from, any relevant information you think might be valuable for us to know. We can just pass down microphones.
Great. I'm Eugene May. I'm a neuroophthalmologist at the University of Washington. Not sure what you mean by where you're from, but for what it's worth, I'm from New Orleans, Louisiana.
It's important.
There you go. All right.
Thank you. Hi, I'm Sarah Simmons. I'm a physician specializing in physical medicine and rehabilitation. And I work at the University of Washington Multiple Sclerosis Center. And I'm from Seattle, Washington, born and raised.
I'm Gloria Hou, and I'm a physician in physical medicine and rehabilitation. I'm also at the University of Washington. I also have a certification in lifestyle medicine. And by the way, Dr. Simmons here also has a PhD and does research. Yeah, you're welcome.
See if this works, yeah. So Tara Zier, I am the founder and CEO of the Stiff Person Syndrome Research Foundation. I was a dentist for 20 years before I became affected with stiff person syndrome. And I am from Bethesda, Maryland. Happy to be here. Thank you for having me.
Hello. Hi, everyone. My name is Vanessa Gallegos. You pronounce it like ego, let go my ego. Vanessa Gallegos. Born and raised in Southeast Idaho, and I have CNS Vasculitis. Still working on a final diagnosis, but I can safely say that it is CNS vasculitis as of July of this year, and working with Samira as Idaho's first ambassador for that. Thank you. Whoa!
Yes, thank you so much. Where I would like to begin is in the spirit of our topic today, managing symptoms and comorbidities. What does that look like on a day-to-day basis within your practice? Anyone care to start?
Well, as a neuroophthalmologist, I see patients with these neuroinflammatory conditions when it affects their vision. So a lot of people that we see as neuroophthalmologists have vision loss either in one eye or both eyes. And another type of vision problem that people with these conditions can have, as many of you know, is double vision or oscillation of vision, where the vision seems to bounce instead of hold still. So a lot of what we do is diagnostic when people come in with their first symptoms, and try to help them and their other doctors sort out what might be causing the symptoms. But regarding symptom management, once the cat's out of the bag, once the symptoms are set in, then neuroophthalmologists can help with low vision assistance for people who have significant vision loss in both eyes. We refer people to low vision optometrists and to low vision services, at least in Washington State, is the Department of Services for the Blind. There's also a nonprofit that's called the Lighthouse for the Blind that provides all sorts of vision assist devices. People with severe vision loss who need assistance with ambulation are taught how to get around their house, get around their town. You can get seeing eye dogs and whatnot. And then for people with double vision and eye movement disorders, we frequently can provide glasses with prisms or use medication to help control the eye movements so they're not quite so symptomatic. The other thing we do that I think is important is when people have a rare inflammatory condition, they can have visual symptoms that have nothing to do with the underlying disorder at all. And as you know, if you have a condition like NMOSD and you start having blurred vision, that's an extremely frightening situation to be in because you never know whether this is going to be the one where you lose vision completely. So we frequently see people who may have optic neuritis, for example, from NMOSD, but as it turns out, it's not NMOSD, it's their cataract or glaucoma or something. So we help kind of settle things out and determine if a visual symptom may truly be neurologic or not.
As I mentioned in my introduction, I'm a type of physician called a PM&R doctor or rehabilitation medicine, also called a physiatrist. We have a lot of different names. And my job, what I do in clinic, is to see patients and help them with the symptoms and the things that are affecting them the most on a day-to-day basis. And so what can I do to help manage symptoms that will help you function best? And so I don't do the diagnosis of these autoimmune and neurologic conditions, and I don't do a lot of the disease-modifying therapies, which is such an important aspect. But it's really actually like, I love my job because when I see patients, I get to focus on kind of those day-to-day things that I get to say, hey, okay, what is the thing that is most impacting you right now on a day-to-day basis? And then we get to focus on that. So I never know what I'm going to talk about with kind of my patient, really, until we're in the room and they've answered that question, like, what is the thing that is most important to you right now? Sometimes that's bladder symptoms. Sometimes that's bowel symptoms. Oftentimes it's mobility. Gloria and I have some specialized training in kind of assessing mobility and walking problems and managing different aspects of that. Spasticity management, which is like cramping or overactivity of the muscles. Neuropathic pain can be a big one. And mood issues are big ones that we see a lot and kind of help people with. Yeah.
And I guess I'll, since Sarah already said a lot of what I do, I'll try to think of other things. So I sometimes also talk with people about swallowing or fatigue management or cognitive concerns. And sometimes it's also about stress management, or people may have questions about, well, what should I be eating? I have questions about exercise. And sometimes it's about managing the symptoms in the context of everyday life. How do I do this and balance work and family? And it's also about connecting people to our team, because we have wonderful physical therapists who help people with their mobility, occupational therapists who help with adaptive equipment, safe strategies in the bathroom, or conservation of energy. And other people on our team, like our vocational counselor, because there are important questions. We disclose this illness at work. What should I do when things are so uncertain? We also have rehab psychologists who help with cognitive testing, with dealing with uncertainty. And so there's a lot of things that we can offer to people. It really depends on what your concerns are.
Did you want me to speak to symptoms? From the patient perspective? Sure. Wow, so how we manage the symptoms, that's a great question. So the symptoms are, if I could speak to that for a second. So the symptoms can vary significantly from patient to patient, and hallmark features, muscle stiffness and painful muscle spasms, but many patients can suffer from extreme fatigue and a whole array of other symptoms like startle reflexes, fear of leaving the home, and isolation. So when you talk about how do you manage all those things, it is definitely comprehensive care, looking at it from many different angles, looking at the need for conventional medicine to play a part in it. I will say, speaking to comprehensive care, having a superstar primary care doctor who can quarterback your health care is absolutely paramount. So when you look at the specialists who are often needed, whether it's cardiology, pulmonology, psychiatry, and having local support, having someone who can quarterback that is absolutely extremely valuable. So in addition to the conventional medical approach, there's also alternative therapies. Aquatherapy can be helpful, physical therapy.
physical therapy and physical activity can be tricky with patients with stiff person syndrome because it can cause pain. And it's finding that balance of how do we dance that line safely, and the importance of talking to your doctor as you navigate that. Because if you don't do movement, if you don't move, then you can get deconditioned, and that's a problem. Mental health support. I'll leave it with that one. But that is so, I think, needed for people not only with stiff person syndrome, any chronic condition. Patients are often dealing with multiple levels of trauma and isolation, loneliness, depression, and having someone who can help support the mental health aspects, I think, is really necessary for these patients.
So in addition to the CNS vasculitis, I've been living with a couple of autoimmune conditions since the age of 16. I'm now 30 fabulous. So my autoimmune conditions, they relate to blood, lungs, X, Y, and Z. But with that being said, I'm a mom of 2. I work full time, and I'm trying to live as independently as possible, right? So with that being said, I do physical therapy. They really help maintain my balance and my strength. With that prednisone, as you know, there's a lot of the moon face, the weight gain, I'm hungry, I get hangry, not just hungry, hangry, right? So that, and then really try to plug into whatever resources are available to you. I'm fortunate enough to have my insurance come into my home, and they were able to put a rail in my shower, so I can now shower solo. Again, just trying to stay as independent for as long as possible. And then I would say self-care, managing all those comorbidities, right? Monthly infusions, that's like, I say I'm getting juiced up once a month for 4 hours. I understand it's an IV therapy. However, like, where's my mama therapy? So I'll watch some trash TV, some Netflix, right, while I'm getting juiced up, and go home and sleep it off and wake up and keep on keeping on.
Fabulous. I am curious to, as we discuss comorbidities and things that might come along with these rare diseases and how to navigate them, how, as clinicians, might you talk to your patients about these more invisible symptoms of an invisible disease, whether it's fear or concern of isolation or worry about relapse? How do you address these in a clinical setting in order to support the patients that might be experiencing things of that nature?
I'll say, I think it's just really important to norm it, and for people to realize that, like, what they're feeling, that's normal to feel that way. Like, so many people who come into office feel, I think it's helpful just to realize that. So that's kind of a starting point at the very least.
I also think sometimes it's hard when people bottle it all in, because I've had people tell me that it's just helpful to be able to talk about what they're worried about, and I offer our support in our resources in our clinic, our rehab psychologists, and then our vocational counselor can also be helpful when talking about uncertainty and work issues. And then just knowing that sometimes with lesions in the central nervous system, sometimes people feel depressed, and sometimes it's not just, oh, I have to pull myself up by the bootstraps. Just knowing that there are options, there's counseling, there's medication, and that they can be really helpful.
Thank you. Tara, anything to add?
Sure. I can piggyback off of that a little bit. I think feeling comfortable with your provider is key. If you don't feel comfortable talking to your provider, you should get another provider. You really need to have a sense of team with your medical providers. We have such wonderful docs who spoke today and talked about the importance of listening, of taking the time up front to take a history that's appropriate, And I think from a patient perspective, education is key. Learn about your disease. And we have a face sheet on our website that you can really document things in a thorough fashion so you can maximize appointment times, so you're prepared with questions and with your history, because oftentimes you only have a certain amount of time with your doctor. So you want to get your story out as quickly as possible. And then advocating for yourself as a patient, so that you can work well together as a team to get the best care.
So Vanessa, as a patient, how do you support yourself through some of those invisible symptoms, as well as how do you communicate with your clinicians about what you're experiencing in order to get the support you need?
See, I've been very lucky to live with my primary care provider. I've been with him since I was about 10 years old. And with that being said, in my smaller hospital and the University of Utah, they both have the interface of Epic. So communication has been very easy, it's flows smoothly, right? We don't have to do the old school faxing and sending things over. Like friend over here mentioned, just advocating for yourself, having a list of medications that have worked, adverse side effects that X, Y, and Z have caused, allergies, a basic too, list of emergency contacts.
Yeah, fabulous. For our clinicians here, Sarah, I know you addressed different comorbidities that you might encounter. What are other specific symptoms or comorbidities, that you really kind of look out for as you are treating populations with rare neuroimmune disorders?
Well, I think something we, at every visit, we have folks fill out kind of some questions beforehand. And I know I hate filling out kind of questions and surveys before I go to the doctor. They can be annoying. But we actually do them for a reason, because we list these common symptoms and we say, is this a problem for you? And I think it's really important because a lot of times people come in and are like, oh, I didn't realize that was related to my diagnosis, or that is so common. And so actually we do really check in all the time about kind of bladder, and bowel goes along with that too. Bladder, bowel. Fatigue is so common and something that is one of those invisible symptoms that I think a lot of people don't necessarily always bring up. And there are actually so many things that we can do to help with those symptoms. So those are a few, but yeah, we also always ask about mood and pain. Some big ones. Cognition, yeah.
I kind of think that in general, all the comorbidities are important, because when people take good care of themselves and they're healthier, it makes it easier to deal with everything else. And so I think it's very important for people to have a primary care doctor. And sometimes people think, oh, well, you guys are our primary care doctors since we see you so often. But actually, I really want people to make sure that they don't have thyroid disease, because that can worsen fatigue. And some of the autoimmune conditions do tend to associate with thyroid disease and diabetes. And those conditions, sometimes diabetes can cause people to have awful nerve pain, and that compounds on top of the other nerve pain that they're having. And I like to look for B12 deficiency, because that can worsen fatigue too. And for sometimes also, I think everything gets attributed to the NMO or the SPS, but it's important to realize that sometimes people have the same conditions that everybody else has, like lumbar stenosis or cervical stenosis, because I've definitely seen that happen too, in which when people have their neck surgery, their pain or their spasms improve.
Did you have something to add here, Dr. May?
Yeah, well, but you can go ahead. I'll go next. Yeah.
About comorbidities, I do have some questions for other patients. So as somebody mentioned earlier with bladder conditions, I've had the opportunity to meet with a couple of patients out here in the crowd, and that's a commonality too with these neuro conditions, bladder issues and dry eye and fatigue. So I'm curious, out there, what do y'all use for like dry eye? Like for example, me, I'm using like Sustain all the time, Sustain drops, but my eyes are done like after 8 p.m. Like if we're watching a movie or driving, I'm like, I'm still awake. Like I'll tell my husband, talk to me, I'm here, I'm listening. My eyes just can no longer open for you. So what do you guys do to manage the dry eye or the eye tiredness? Anything out there? Any comments? Okay, so dry eye.
Michelle right here has a. Artificial tears or gel eye drops. Yes, absolutely. I agree with that
I
one.
love
Yeah,
it.
that can make a difference more so than just the regular refresh tears.
And then overstimulation, like I have lesions in my brain, right? Some of us have lesions, some of us have scars. Again, I work full time. I'm a dietitian, registered dietitian. I got these patients to chart on. I got to get to work. I love me a latte. So when I'm at the coffee shop, I'm like, give me a latte, just a single shot, because I'm already hopped up on that prednisone, right? So when you guys are feeling overstimulated, it's like an anxiety and overstimulation. I'm in trouble, like I'm rushing. How does it feel when you're overstimulated, and when do you feel it? I.e., if I'm at a super busy grocery market or getting ready for a concert, any emotion, whether it's sad, mad, happy, joyful, I get that head fullness. Does anyone here experience anything similar?
Breathe, someone says.
Breathe.
Step away from the situation.
Oh, there's my little ones, they had a dance recital, and it's like in an auditorium with, I would say, at least 700 people. And I'm there, like, I don't know if I'm gonna be a dance mom, but there's all these dancers, the music is bumping. So I tell my husband, you record, I'm just gonna step out for a minute, and I can still hear the music, but I'm gonna support them perhaps from afar, right? Like you're right, step aside, step out for a minute, breathe. Thank you.
Do our clinicians? Oh, kind of like the.
Yeah. Brings it down a notch. Thank you. Thank you, guys.
Anything to add from the clinical side of things to Vanessa's questions?
Well, I was just going to add, piggyback on some of the comments that were already made regarding visual symptoms specifically. And I think it may be most important for people who are relatively newly diagnosed, but it may be an issue for people who have been carrying a diagnosis for a while and dealing with symptoms for a while, is it's best to have kind of a plan of action ahead of time. If you develop a symptom, what are you going to do as a reaction to the symptom? And for vision specifically, if out of the blue you start having trouble with one of your eyes, for example, do you have the resources ready to reach out to someone who can help you? And to a certain extent, it's going to depend on where you live. It's going to depend on the practice of the physician or optometrist even that you work with locally. It's going to depend on the medical system that you get your care through. But it's good to know ahead of time if something happens, well, what am I going to do now? Can I call my local eye doctor? Can I send a MyChart message to the clinic? If I call the clinic, is someone going to answer and be able to help me? Do I have to go to the emergency room if something like this happens? And for each condition, the answer to those questions is going to be a little different. And it's also going to depend on what the symptom is too. So I always appreciate it when a patient says to me, well, what do I do if all of a sudden my vision gets blurry? And we talk specifically about who you should talk to, who you should call, who you should send a message to. And for people who have a neuroinflammatory condition that can potentially affect vision, I always think it's a good idea to have a good local eye doctor available. That way, if all else fails, you call your local eye doc and you say, I'm having trouble seeing, can you see me? And then that local physician can help advocate for you and get you the care you need, assuming the visual symptom may be inflammatory and neurological.
Yeah, this is a really important thing that I wanted to address here today. Because first of all, one of the more universal aspects of rare neuroimmune conditions is having a physical symptom and wondering, is this my condition or is this because I haven't drank enough water today, right? There's the questions that are like, this could be completely benign or this could be the end. And what I am curious about is, for one, it's so appropriate that you acknowledge, I'm so grateful that you've acknowledged getting clear with your practitioners about exactly step-by-step actions to take in the case of a symptom. Because I remember feeling that way when I was initially diagnosed, being like, okay, so if I have difficulty, with urination, how long do I wait before I start to worry about it or before I start to take action? So I would love to get even more specific with this line of thinking in terms of if someone has a symptom, and obviously, like you said, it's going to vary on a lot of different things, but what would you tell a patient to do A, B, and C? Like, if you notice this, wait this long or don't wait this long, assess the urgency. How do you guide patients to be able to advocate for themselves, to get them the care that they need when they need it without overdoing it when maybe they just need to drink more water?
Well, for visual symptoms specifically, it really does vary based on the condition. So when people have NMOSD and they start having visual symptoms in one eye, that can be an emergency that needs to be evaluated and treated right away. Most of the other conditions that we're talking about today, I can't say exclusively or 100%, but most aren't quite so urgent as it can be with NMOSD. So for sarcoidosis, for example, or MOGAD, it's important that you let your team know if you're having visual symptoms. You don't have to go to the emergency room, though, as long as you know that you can access the people who can provide you care. Now, if you can't for whatever reason, then you may need to get emergency care. But for most conditions, it's not super emergent. NMOSD, I think, is a little different.
Okay.
Yeah, I'd say that it's so helpful when you have a team. I mean, it really depends like on the actual symptom and what's happening, but it's so helpful when you have a team that has some sort of availability to ask that question. So like in our clinic, we work really hard to make sure that we have an amazing nurse triage team that like knows about these conditions, that you can call in and ask if you're worried, if you think like, hey, should I be doing, and they can help guide and triage. And we're also like work really hard to have same day appointments. What it might be from one of our great nurse practitioners, maybe not your actual doctor, but to get that kind of urgent care. So if there's a question, we call, the nurse can help triage and maybe get you in same day if needed. So having that team, but a lot of our patients that we see at the UW MS Center, and we don't only see MS, we see a lot of other neuroinflammatory disorders, as you know, but a lot of them live far away, so we really advocate for having somebody locally. I think what Dr. May just said, having somebody locally who can start the workup, because sometimes it is a urinary tract infection, and that is a very different treatment than, IV steroids or plasma exchange, right?
And perhaps that is more of the question, because obviously visual symptoms might be a little bit more alarming, but when it's in that gray area of like the comorbidities, the symptoms that might not be as obvious, like a UTI is a great example. And so I think that's helpful for you to speak to that.
Yeah, and so I think that it's really important kind of to get that local workup, to get tested for other things that it could be that happen commonly and can cause some overlap, and not to just always assume that it's the neuroinflammatory condition. Because your neurologist and the people treating kind of a relapse or whatnot are going to want that local workup anyway. So getting that started is very, very helpful.
So I agree with Sarah. I mean, it's always a really complicated question. It's complicated for the physician too. Sometimes we'll get messages saying, "What do you think about this?" And I'll be like, well, I really need more information. And so I would say that it's important to think about what the typical range of your symptoms are, because everybody has good days, everybody has bad days, and if something's totally out of your ordinary, then that's probably something that needs to be escalated quickly. And it also depends on age. Sometimes I have patients who are in their 70s or their 80s, and they assume everything is due to their neurologic condition, but they have a sudden change. And I want them to go to the ER and get checked out to make sure that they don't have a stroke. So there are a lot of different considerations, and I don't feel like it's fair to expect patients to muddle through it on their own. If you're worried, we would rather have you call and ask.
One thing that helped me significantly was talking to my neurologist about a real worry of mine with SPS, knowing, even though it's rare, that there could be life-threatening breathing complications. And that was just weighing on me, going, well, how quickly would that happen? Would I be able to get to the ER in time? Are my children going to find me dead? I mean, it sounds graphic, but those are the things that were going on in my head. And I was able to, talk with my neurologist about these fears and concerns. And it's like, okay, let me prescribe you intramuscular Valium. And, just being able to work through that, I think, with your doctor and understanding these are the real concerns. How do we work together? And just that one thing just really alleviated that for me. So, thank you all for listening to and working with your patients, but that was a huge help for me. So.
Fabulous, thank you. As we continue our discussion up here, I do want to open up the chance for questions. So should there be any questions, please raise your hand. I'm going to be keeping an eye out for our panelists up here. As I ask my next question, be thinking, raise your hand if you have anything to ask. We have talked about today the diseases themselves, and what we're discussing up here right now is more of like the secondary layer, right? So it's like we've got the disease, we've got the study of it, the managing of it, the medications for it, and now we've got symptoms, comorbidities, and other more invisible elements to it. What do you all see are the most unmet needs in the world of this secondary layer, in the world of the symptom management, the comorbidities, the other things that patients might be encountering day to day that might not get as much attention as like a clinical trial for a specific drug?
Part of me feels like there can be a limited access to resources, particularly mental health resources. It's very frustrating for me and for patients who want to access counseling, and sometimes it's hard to find a counselor. And so sometimes I'll just tell people that there's a website that I don't know. Oh yes, Psychology Today, and sometimes it takes going in knowing, okay, it might take 20 calls. I'm going to block an hour of time and just call 20 people and see who is available. And they shouldn't have to do that, but sometimes that's what it takes in this world of ours.
Anything to add from either of you?
Yeah. Well, I would say that in Washington State, we're pretty lucky that we have low vision services for people who have lost a significant amount of vision in both eyes. But in our neighboring states, it's not quite so good. And particularly, I've had a bunch of patients from Alaska who have a great deal of difficulty getting low vision services. And it can be hard to find a low vision optometrist, especially in a state like Alaska that's so big and so rural. The state support is not as good as it is in Washington. I'm not quite so sure about Idaho and other neighboring states, but I would say that it's a challenge, and unless you happen to live nearby someone who does low vision, to get that. Yep.
Yeah, absolutely. Anything to add? From a patient perspective, do you feel like there are unmet needs? I mean, I shouldn't even say if there are. Which ones are there?
How much longer do we have? No, I mean, I think from a patient perspective, not knowing which treatment to do. So, for example, with stiff person syndrome, I know there isn't consensus on treatment, whether you start with symptomatic therapy in conjunction with immunotherapy, or you wait and just start with the medications to help try to manage the symptoms, and then do immunotherapy if you get worse, and then not knowing. I think that's really difficult from a patient to say, well, do you know if taking immunotherapies early on is going to give me a better outcome down the road? And it's like, well, we don't really know. We think it might. And it's like, well, how do you make a decision as a patient when you know that these immunotherapies have significant risks? So it highlights the need for more research. And I just want to acknowledge people who are looking at, doing the research to help guide patients better in making decisions.
Yes, thank you. Anything to add, Vanessa, as we finish up? Okay. Do we have any questions for our panelists up here today? Okay. Thank you. Oh, we do have one right here.
I don't know if you just need somebody to break the ice, but I figured I'd take a stab. So I'm just kind of curious from both the providers and the patient's perspective. We live in the age of apps. There's an app for everything. Some of them are better than others. Have you found any that are actually helpful to you, Dr. May, for patients if they are able to self-assess with some nifty little smartphone app?
It's called TikTok. Check it out. You can get diagnosed on there really easily.
You can also get misdiagnosed really easily, so that's the only problem.
Offhand, I can't think of one. Yeah.
Yeah.
I'm sure. I mean, if it's helpful, it's been helpful to you, let's hear it. Yeah.
Sources. I'm in Southeast Idaho. This is where I go on my rant. I was able to, for my capstone project, I made a Facebook page. In Southeast Idaho, there's a lot of ag workers, therefore a lot of Spanish speakers. I feel that services need to reflect the demographics, and they're not. Caldwell, Boise, Meridian, they're doing beautiful things for the Spanish speakers, but in my neck of the woods in Southeast Idaho, not so much. So my Facebook page is called Salud Southeast Idaho, a play on words. Salud means cheers, and it means health. So let's cheers to what's happened, but let's build upon to improve health and wellness for all. But with that being said, I had the opportunity to connect with my local hospital, health departments, and local clinics, free clinics, food banks, X, Y, and Z. And together, we were able to create material in Spanish to serve that population. But one of the things I came across was findhelp.org. I'm sure it's a national program, not just Idaho-based, but findhelp.org, they will connect you with resources related to housing, food, mental health services, transportation, things like that.
Fabulous. Thank you.
Actually, can I just add something to that? This may be helpful more to the docs in the room, but I learned this from one of my hearing impaired patients. There's this app called Wavello, like Wave Hello, Wave LLO, with which you can communicate with your patients who use sign language through your app. So it's free, you call them, they connect you with the interpreter and the patients there. It's like this little video platform. And a patient of mine told me about this. I've never heard of it, and it was extremely helpful. I've used it a few times because most of my patients don't have problems hearing, but for the few who do, this was very life-changing. And after that one patient told me, I think I told all the other ones about it. So there you go.
We've got another question in the back here, yes?
You hear me? Okay. I just had a quick question about whether or not there has been, in managing symptoms, any association with things like red light therapy or supplements or detoxification or other alternative therapies besides strictly medicine that can be used as a supportive mechanism for patients and caregivers that are dealing with autoimmune sorts of neuroinflammatory diseases.
Yeah, actually, Gloria and I, we use a lot of non-medication options when we see patients, and it really depends on kind of what the actual symptom is, kind of what non-medication option we use. Supplements, especially when people are low in things like B12, like that's a really common one that we check for. Magnesium, we often use for people who have a lot of spasticity and cramping, but it's really kind of important to talk kind of through your actual case and kind of what you're presenting with. But I'd say I am a big believer in exercise, and I do a lot of my research on that, and there's a lot of evidence that it can help with so many different things. So that's kind of a really big, like, physical activity, movement, and exercise. You'd asked earlier about kind of gap, and I think a big gap in neuroinflammatory conditions is myelin repair and kind of recovery of those CNS injuries and lesions. And I think there's a lot of research on medication and pharmaceutical options for that, but there's also a lot of research kind of on whether exercise and kind of physical activity can at least promote those things. And we're still early on; we don't know a lot, but I think there's some good initial preliminary data that those things can be really neuroprotective and might enhance repair. So more needs to be done, but using that for a lot of the symptoms that come along with neuroinflammatory conditions.
As a lifestyle medicine physician, I also, the general belief of lifestyle medicine physicians is it's more important to eat a broad range of fruits and vegetables and foods with fiber as opposed to focusing on supplements. I feel like a lot of times people are like, take this supplement, and then down the road somebody's, actually that supplement increases death. And so, or people are like, take resveratrol, it's great. And then down the road they find, it doesn't do anything. Maybe it was the actual grape. But in terms of fiber, it gets digested in our gut and it gets turned into short-chain fatty acids, and that the short-chain fatty acids are most likely anti-inflammatory. And my patients tell me that when they eat well, they feel better. And the deeply colored fruits and vegetables, they have a lot of different antioxidants. And when we try to isolate things out in a supplement form, we don't know, is it really just that one component of that food that was helpful, or was it some other component we had no idea about? And I also like to tell people to avoid processed foods if possible, because there's a thought that the processed foods, they have emulsifiers in them. Like if you look at the lists of ingredients, if it says things like maltodextrin or titanium dioxide or carrageenan, all those things dissolve our gut lining, and the bacteria in our gut, they produce toxins too, and those toxins can more easily get through the gut gut barrier if we have a leaky gut. And there are lots and lots of white blood cells that live around our intestines. And those white blood cells can go anywhere. They can go to our central nervous system. So I generally just try to tell people to eat as healthy as possible. And that I think that will do as much as one particular super high dose supplement, because even like vitamins that are good for us, if we overdo it, it might not be good for us. Like I think it's important for people to have normal vitamin D levels, for instance, because especially if they have balance issues, they could end up having a fracture. But if the vitamin D level is too high, that can also make bones brittle. And so my general philosophy is to try to spend the money that you spend on supplements on good, healthy food.
Absolutely. Do you have something to add? We'll close.
Yeah, it's saying please wrap it up with an exclamation point.
Yeah, it's yelling at us.
But just a couple things that have helped me that I wanted to share. I've done trauma work. It's called EFT. It's tapping. I just wanted to put that out there to anyone. It's really helped me quite a bit. Also, having really firm boundaries. So I envision my health like at the top of a triangle, and it's like a dot in the middle of it. And when I think about relationships, people, events, if it doesn't fit inside that triangle, then I can't participate. And I can easily say no. I think it's surprising for people sometimes. I'm like, I'm sorry, that's not healthy for me. I can't do it. But when you get that comfortable and you can really protect yourself and really manage the stress exacerbates symptoms, when you can get there, it's really a peaceful feeling. And then one other thing I will say, and this was talked about in our breakout session, is being very, and I say grateful, but there's a whole nother level of language used in saying, I get to do something. So not even just I'm grateful, but I get to be here. I get to have a cup of coffee. I get to talk to Dr. Roy. So having that language and thinking about things through that lens, at least for me, that's been super helpful.
Such fabulous wisdom. Let's give our panel a round of applause, please.